With Silvia Petretti, we talk about the cuts of British government to public health, in particular about the fight against HIV/AIDS. What's the situation now?
At the moment in the UK, we have been having a record new diagnosis of HIV, so the epidemic is still growing, and in spite of this fact, there has been over 50% cuts in prevention services and sexual health, in the funding for prevention and sexual health. So this is really worrying because obviously, it's a bit of a crisis when, infections keep growing, but the funding to inform and protect people are not really there. So, and apart from the cuts in prevention as well, a lot of the support, the social support that people need as well to stay healthy has been decommissioned. So a lot of councils have stopped, and local authorities have stopped giving funding to provide social support and social care specific to people living with HIV. So that's another very worrying issue at the moment.
And about the treatment?
Well, at the moment, I think there are also tension about the funding of treatment. The new research, the START trial, shows that people living with HIV benefits from treatment regardless of their CD4 counts so people should have the possibility to start treatment as soon as they're diagnosed. But at the moment, the NHS is still not clear if they're going to fund treatment on diagnosis, in spite that that's the scientific evidence. And then in other areas as well of disease, like hepatitis C, there is very, very good new treatments available, but unfortunately a lot of people are not able to access it because the NHS is not funding it unless you have a very advanced liver disease.
And PrEP?
PrEP. As I said, because there is such a record of new diagnoses, we really need to have as many prevention tools as possible, including PrEP. At the moment, the process of approving PrEP in the NHS is moving very slowly, and as things are now, probably PrEP will not be available until 2017, and that's too late because every year at least we have over, I cannot remember the exact number, but I think around 6,000 new diagnoses every year, and maybe this could be prevented, at least some of those, if people had also access to PrEP.
However, people can get PrEP privately from abroad.
Well, there are ways of getting PrEP privately. There are clinics in London that provide it for £400 a month, which is not something that most people can afford. It can be bought on the internet, but there are issues about safety. Are you really getting the real drugs? And also PrEP, Truvada, the medication that is used in PrEP, is a serious drug. It shouldn't be taken without medical supervision. So it's not acceptable that PrEP is not provided on the NHS, because people should be taking it within a good healthcare settings in which they can have monitoring, in which they can also discuss their other sexual health needs, because PrEP is only part of prevention, is only part of the answers. I think people need to access good services, have PrEP if they need to, but also have access to psychological support, to ways of having the sexual life that they want and making healthy decisions about the sex life. It's not just about taking one pill. So for me, it's about good holistic prevention, and getting PrEP on the internet is not that.